Hey guys, it's Dr. Syed here, aka Real Skin Doctor, and in today's video I'm going to be talking to you guys about hair shedding. This is specifically going to be talking about that situation in which you notice a lot more of your hair shedding than usual. For my patients, that's usually either on their comb while they brush their hair or in the shower when they look down at the drain. For those of you who are new to the channel, I'm a doctor specializing in dermatology, and it's my aim to help you navigate the wild and confusing world of dermatology and skincare using some basic scientific facts. I'm going to start by talking about hair loss overall, and then I'm going to talk about one of the most common causes of hair shedding that I see in my patients. I'm going to give you the specific story of someone I saw in clinic over these last few years to help illustrate the point, and I'm going to end by giving you some advice on how to deal with this specific form of hair shedding. Now, there are tons of different causes of hair loss. This can run all the way along the spectrum from normal age and genetic related hair loss all the way through to infectious diseases and even immunological disorders like lupus that can affect the hair. There's going to be future videos on this channel where I talk about every single one of these types of hair loss, but for this video in particular, I'm going to be talking about hair loss caused by excess shedding. Let me tell you guys about a patient of mine who I saw in these last couple of years called Rachel. She was 32 years old and I remember it clear as day. She came into my clinic room, sat down, and she was in tears. She had noticed that in this last month, she had been shedding a lot of hair. And when I say a lot of hair, I mean a lot of hair. She had literally brought in with her a Ziploc bag full of chunks of her own hair just to show me how much she had shed in the last week prior to our appointment. She told me how before that point, she had always been complimented on how thick her hair was, and it was something that was really key to her own perception of herself. She even described how whenever she used to clump it up to make it into a ponytail, it was so thick that the hair wraps she had could barely even fit around it. And then seemingly all of a sudden, clumps of her hair started to fall out every time she stepped into the shower. She was so concerned about it that she started to reduce the amount of time she would brush her hair and also reduce the frequency of her showering, which used to be once every other day and now was once per week. She said she just couldn't handle seeing those clumps of hair on the brush and in the shower, and she was just wondering how much longer she had before she was completely bald. Now, this might seem dramatic to some people, but honestly, hair loss is one of the problems we see in dermatology that causes the most psychological distress to our patients. To some people, hair is just something frivolous sitting on top of their head, but for a lot of people, it is a key part of their overall identity, and it makes them extremely conscious to think that they could have a bald patch or to look like they have a reduction in their hair density. This notion of patients coming in with bags of their own hair also may sound a little bit weird to people, but we actually see it all the time. And I think it's really important as dermatologists not to see this as patients being somehow psycho or crazy bringing in their own hair, but more that they're just really keen to emphasize to us the extent of the problem with which they're suffering. I took a full clinical history, of course, trying to find out whether she had any other medical conditions that could be involved in this, whether she was experiencing any new symptoms alongside the hair loss, and also whether she was taking any medications that I should be aware of. Next, I analyzed her scalp itself to identify which areas the reduction in hair density were more focused. I also took a look with my dermatoscope, which is a magnifying tool your dermatologist might use to help get a sense of whether or not there is any inflammation or scarring present on the scalp itself. We also sent a panel of blood work because it is known that certain conditions such as thyroid problems, iron deficiency, or also vitamin D deficiency can contribute to hair shedding and hair loss in our patients. So in Rachel's case, it turned out that she had a condition known as telogen effluvium. Now, the hairs on our scalp go through a series of normal stages. At any one point in our scalp, around about 90% of the hairs are in the growth stage, also called anagen, and around 10% are in this resting/shedding stage known as telogen. Now, out of those 10% of hairs that are in this telogen resting/shedding phase, it's normal for around about 100 to 150 of those to be shed in any one day. Now, that sounds like a lot, but every single one of us actually shed around about 100 to 150 hairs each day without even noticing. In the case of my wife, I'm fairly confident she sheds around about 500 to 1,000 hairs per day, mainly into my clothes, but that's a separate issue. During telogen effluvium, some kind of trigger inside the body causes the number of telogen hairs to go from 10% on the scalp to the higher level of around about 20%. Examples of some of the most common triggers we see for telogen effluvium in our clinic include giving birth, having a fever or some kind of infectious process, starting a new medication, especially Accutane, having periods of significant weight loss, or actually stopping oral contraceptive pills can also be a trigger. There are many more of these, and some really weird ones, like studies showing that jet lag can be a trigger for telogen effluvium. So when one of these triggers occurs, an alteration in some kind of signaling in the bloodstream tells the scalp hairs to shift into telogen. However, it takes around 3 to 4 months after these hairs shift into telogen for you to actually notice them physically detaching themselves and shedding. This is because although the hairs have have shifted into this resting/shedding phase at the time of the trigger, they're still pretty firmly attached to the scalp at this time. They only actually become loose and fall out when a new hair from underneath starts to grow and pushes them out. So in a weird way, with telogen effluvium, noticing your hair shedding is actually the first sign of recovery because it means a new hair is growing from underneath. Now in Rachel's case, with some careful history taking, we did actually manage to establish that she had stopped her oral contraceptive pill 3 to 4 months before the shedding of her hair began. So she really did have a classic case of telogen effluvium. Now, I really wish there was a better answer to this question, but the truth is that once the trigger has happened and it's caused the scalp hairs to shift into the telogen phase, nothing is really evidence-based to show that it can reverse that process and turn them back into anagen or growing hairs. But the good news with this type of hair shedding is that in the vast majority of cases, all hair regrows within 6 to 9 months completely back to baseline. Now, the recovery begins at 3 or 4 months at the exact point at which you notice the shedding, but it then takes a few more months for those new hairs to grow out to the length at which you notice the density of your hair returning to normal. So the truth is, you just have to sit back and trust the process, as difficult as that can be when you're noticing clumps of your hair coming out in the shower. If it makes you feel better, telogen effluvium actually never involves even 50% of your hair. So no matter what it can look like when you look down in the shower and see all those clumps of hair, you're never going to go bald with this type of hair shedding. Not even close. And you'll be happy to know that with Rachel, at our follow-up appointment many months down the line, she came back with her hair density restored and she was beaming as she walked into the room. So we've discussed one of the very common types of hair loss that I see in my clinic, but I can't emphasize enough, if you think you're dealing with this problem or another problem related to hair loss, it really is so important to see your dermatologist if you can. You deserve to get that full workup of a detailed clinical history, a physical exam, and also blood work if it's indicated. For more videos like this where I discuss common skin, hair, and nail problems that I see in my clinics, please do subscribe to the channel. I'm going to be making new videos at least every week talking about super common dermatology problems, as well as giving some product reviews and recommendations. So do hit that subscribe button right there. It only takes a couple of seconds, but it means a lot to a new creator like myself. So with that being said, thank you so much for watching, and I'll see you in the next one.